is the leading cause of death in pregnant women during the first trimester. Now, what is ectopic and how does it happen? I have here with me this diagram to help us to appreciate it well. So this is the female reproductive system, which contains what? Some organs. So we have here to be the what? The uterus, and the uterus connects to the two ovaries here by the two fallopian tubes. And we have here to be the cervix and the vaginal canal. Now, the only place that is meant to support the developing fetus during what? Pregnancy is the uterus. And so we say any pregnancy that happens outside the uterus here is termed as what? Ectopic gestation. Now, 4 areas could be identified, but the most common place is the one that happens in the fallopian tube here, which accounts for about 90% of cases of what? Ectopic. The second area could happen here in the ovaries, the third one on the cervix, and the fourth one in the abdominal cavity. Now, how does a normal pregnancy take place? Where a spermatozoa or a sperm will travel through the vaginal canal and it will find its way to the fallopian tube here to go and fertilize a matured egg during ovulation. Once an egg is being fertilized, it is being termed as what? A zygote. So the zygote will also undergo what? Cellular division to come and form what we call what? The molar. The molar will also undergo what? Cavitation to come and form what? The blastocyst. So the blastocyst is what will journey and what will be embedded here in the uterus so that it will continue to grow to form the baby. But then in ectopic, there's hindrance, right? So the fertilized egg got stuck here, as you can see here, and then will continue to develop there. All right. So what are some of the things that could lead to ectopic gestation? One is previous ectopic condition. So somebody who have already experienced the condition before also stand another probability of what? Having another ectopic. The second one could be as a result of what? Infection like PID, pelvic inflammatory diseases. Some of these causes what? Scarring and adductoriasis of the reproductive system. And some people are even born with what? Defects of their fallopian tube. Another one could also happen as a result of what? Emergency contraceptives. In fact, it could happen as a result of what? Wrong timing or even what? Abusing some of these emergency contraceptives. In fact, if you do research, you even find out that people who regularly take some of these emergency contraceptives stand what? A very greater risk of what? Having future miscarriages. Because the more that you continue to take some of these emergency contraceptives, it causes what? Damage to the uterine walls of what? Of your uterus, which what? Further lead to what? Damaging your uterus. And then in future, you may what? Experience what? Miscarriage. So you should be careful. And you can also do more research on this thing that we are talking about here. Now, what are some of the signs and symptoms of ectopic? One is pain. There will be pain. Pain in the lower abdomen and also what? At the lower back. Sharp pain also in the what? In the tip of the shoulders here. And also what? You feel dizziness and also what? Fatigue. So what then can we do? That is why we continue to encourage our ladies that once they find out that they've made their period, then they should what? They should go to the ANC to what? To go and do what? To go and do a scan for us to get to know where this baby is. So if the baby is found in the uterus, then everything is okay. But then if we find out that the baby has been what? Has been embedded in the fallopian tube like this one, then immediately we can what? We can treat it what? By medical what? By medical means. But then if you feel reluctant and then you don't want to go to ANC, once you know that you are pregnant and then that pregnancy is what? It's an ectopic gestation, then you are doing yourself harm because what? This can continue to grow as you can see here, and then what? It will burst or what? It will rupture. That will pose significant risk to your life. All right. So this is for ectopic gestation, and please, I want you to stay tuned and also please follow me for more.